Medical equipment is generously donated to hospitals in Africa from many different sources, but it can quickly become obsolete without the skills to maintain and repair it. The Amalthea Trust is a UK-based charity that helps to provide sustainable maintenance of this equipment by sending volunteers to Uganda with the purpose of training a new generation of homegrown biomedical engineers.
My name is Jas Belku and I work at the Royal Wolverhampton Hospital Trust as a senior clinical technologist. Here Uganda does not have any biomedical technicians in the hospitals. A lot of equipment is being donated but it's not being serviced or repaired. So if anything minor faults happen, they just put them in the stores.
I remember I was in Senior 3 when I heard about this course, though it wasn't already in Uganda. So I read about biomedical engineering and I saw how it is related to medicine and engineering. So with biomedical engineering, you really save lives.
My uncle passed away. He died of cancer. And he died just because we never had enough equipment to treat or to treat the cancer. So when he died and I got to know about the course, I realized there's need for biomedical engineers.
The Trust does this by working with and through existing local institutions, and in Uganda has been working with Chambogo University in Kampala for the last 5 years, adding the practical expertise of volunteer engineers from British NHS hospitals to the teaching of the country's first biomedical engineering diploma course.
Some of our interns here in Chambogo have gone through Mengo Hospital, and also we've had very many volunteers who graduated from Chambogo University. They've gone through Mengo Hospital and they have acquired skills, and now they are in various companies supporting medical equipment management.
Training was given to students to be able to learn how to manage this equipment, and the training was tailor-made to our hospitals, which are facing very big challenges in terms of the management of equipment. And so far, since the program started, we have trained about 60 or more, graduated 60 or more biomedical engineering technicians, most of whom are already employed both in the private sector and in the hospitals.
The charity is only able to do this work through the volunteering of time and donations to help pay for tickets and accommodation.
The feedback is very positive because during the lessons there are a lot of questions from students.
Whether you wish to donate your time or your money, please get in touch with us, as every donation is potentially bringing better healthcare within the reach of ordinary Ugandans.